Hi, hello. Once again, I'm going to talk about relapse prevention. Today, I was working with my patients, and what was striking for me is that a patient of mine said, I'm a failure. And it was really hurting deep down to go through that emotion with my patient. Saying and feeling that I'm a failure because I keep relapsing. The first time I went to a treatment, when I was in my 20s, I said to myself, I will never be in this position in the next 5 years. But I'm still here. Can you imagine what that person is going through? And on the contrary, I also had this viewer's question. I relapsed, and it's because I blame it on my mother for having a fight with me. If not for that fight, I wouldn't have used. And then stops and says, I want to stop this blame game. The only reason I'm relapsing is because I wanted to use. I realized that. It is such a beautiful journey, and I wanted to talk about that today with you. I think that's a lot of folks out there basically misunderstanding relapse. We need to talk about this misunderstanding. Relapse is complicated. It's not a simple thing. It's not just about the willpower. It is a process. And we tend to think about this as a single event. That was one slip up, or maybe a failure in that moment. Or we say that I didn't have this willpower, but there is much more to it. There's so much more to it. These are a whole range of things that's happening, both internally, externally, and also in our relationships. Imagine there are three big buckets: internal, external, and the interpersonal. Let's tackle one bucket at a time. So let's talk about the internal bucket. It's my fault that I didn't fight hard enough. So you need to dive right into your internal thing, your anxiety, your depression. Or it's not just your choice that I'm choosing this. There might be other things that's going on. These are the things that are very real. And it can really deplete our reserves, and we make decisions that are going to be detrimental. So the depletion of all the resources, that's what it is. It's that much harder to resist those cravings. It's important to recognize the internal triggers and to be kind to yourself. We often beat ourselves up saying that I should have done this, I should have done that, but we are not taking into account the full picture of what's happening. What is happening internally and externally. Let's talk to the external bucket. What are the external factors? Think about the environment here, the world around us. Think about those places that maybe you associate your past with, relapses with. Those are the triggers. Maybe walking past this old favorite bar, or maybe it's running into a friend that you used to engage in those unhealthy behaviors with, or certain street, or certain smell. The smell can even trigger all those memories. Or driving through and you're looking at the billboard, or the name of the town can also be a trigger. And it's a big life stresses, relationships. So financial troubles, job loss, any of those things, it's really kind of tip the scale and make us more vulnerable. The smaller social interaction with the social pressures, you need to drink to fit in a party, or just like, I just want to have this thing because everyone else is having it. It's easy to get caught up in those kind of social situations. Especially we have not thought about these things beforehand. So we have the internal stuff and the external stuff. And then there's the third bucket, which is the interpersonal relationship. Our relationships or connection with other people. This can be either our bigger sources of support or potentially a trigger. So how do we kind of figure this out? Well, you need to look at the dynamics. Within your relationships, are you able to communicate? Are you able to set boundaries? If you're not able to do those things, then it can lead to resentment, and it can lead to tension, and it can make it harder to stay committed to your goals, which is being sober. So you're fighting those battles on the other front. So, then there is it's not an intentional, in lives there is like unhealthy behaviors, like thinking they are helping, they are trying to harm us, and they're trying to protect us, but actually it's not working out. It's enabling. So it's really important to look at those dynamics and be honest with yourself. And you need to really be honest with what's happening in this relationship. So there is an internal, external, and an interpersonal buckets that we talked about. So how are they contributing to the process of relapse? There's this one thing that keeps coming up is the blame. Whose fault is that? The blame is such a common reaction when you experience relapse. It's so understandable. We are feeling a lot of deep emotions. We are feeling ashamed, we are feeling disappointed in ourselves, or even angry. But the problem with blame is that it keeps us stuck. And so how do we move away from that? Instead of focusing on who, focus on why. What are the factors that contributed to my relapse? So those triggers can be internal, external, or interpersonal. Why did this make me vulnerable to go back to this faulty coping mechanism? Instead of pointing fingers at others, don't judge. Move forward. So this happened. Now what do I move forward? How can I learn? What do I learn from this, and how can I move forward? So it's self-blame or blaming others is not going to be helpful. It's recognizing that you have the power to learn from this lapse or the relapse and to move forward. So the theory of why did I do what I did? What can I do differently? And you should have those kind of tools to really use. The first tool is that self-reflection. That's where the tools like journaling and mindfulness can really come in handy, right? So how does this work? Journaling allows you to track those lot of feelings, the behaviors, and start to notice the pattern. And mindfulness can make you stay current. And so it's like hitting the pause button before you make a choice. So that's the mindfulness. Instead of being regretful, your internal warnings that you are listening to that. Even though these are physical sensations that might be telling you, oh, we are heading down the slippery slope. So pay attention to your body. Your body is telling you. And also we can also build a toolbox, for coping mechanisms. Finding things that helps you manage your stressors. For instance, deep breathing exercises can really be helpful to calm your nervous system in the moment, or engaging in activities that you enjoy to boost your mood. It's like a whole bunch of different things. Like you can try to see what works for you, because there is no one size fit all. Absolutely not, right? So we talk about the importance of relationships and how do you actually build that support network. It might involve seeking professional help. That might be therapy, it might be joining a support group, or where you can connect with others who understand your feelings, and finding your people. That's basically what it is. It doesn't have to be a formal thing either. It could be as simple as confiding in a trusted friend or a family member. So somebody you trust. So somebody who listens to you and you feel that they are supportive, so we talked about all these. So it's also important to be realistic and celebrate those small victories is very important because a recovery is a journey. It's not a destination. It's a progress. It's not the perfection or a destination. We have a huge lofty goals to remain sober, and we set ourselves for disappointment. We are more likely to give up. So break down into small manageable steps and celebrate every win along the way. So small win adds up, and they absolutely do add up, and it leads you to conquer your long-term sobriety. What I want you to take home about relapse, the one thing, it's not a failure, it's a feedback. It's a chance to learn, to grow, and to refine your approach. So it's a detour. It's a detour on a road trip. It might not be the part of the original plan, but it can still lead to some unexpected discoveries and ultimately help you get back on track. It's not the end, it's just a bend in the road. Remember, you're not alone, and there are 70% of the people who do undergo relapse. And so it's not a failure. You can make it. You can help you through this, and you can celebrate victories along the way. So next time you feel setback, whether it's your own or someone else's, approach it with curiosity. Find out with a passion and commitment, the intention to growth. You're learning more. As you're learning more about relapse, ask yourself, what are my strengths? What are the things that have helped me in the past to remain sober? What are the experiences that I can draw on from, which can keep me guiding, moving forward? So we all have those experiences, and it's just about remembering that and tapping into them. Thank you so much for joining me. This has been a really pleasure talking to you about relapse prevention. I hope this comes handy to all my patients and those who are out there seeking help. Until then, bye-bye. Keep on growing.